Even with the Affordable Care Act and the insurance marketplace, thousands of Oklahomans still don't have health insurance. For many, especially in rural Oklahoma, decisions made at the top levels of state government have forced them to rely on free clinics as their primary health care provider.
Just take a big breath in for me, and out. Big breath.
Sandra Lawrence Gregg has been coming to the Hope Medical Clinic in Elk City since moving back to Oklahoma in July. Before that, Sandra lived in Kentucky, where her family still resides, but it's not where her heart is.
Oklahoma's home, and my husband is from Oklahoma. He wanted to come back, and I wanted to come back so bad I couldn't stand it. So it was back to Oklahoma.
The decision to move back came with a price. While Kentucky decided to expand its Medicaid program last year, Governor Mary Fallin rejected federal money to do the same in Oklahoma, leaving an estimated 200,000 lower-income Oklahomans in a coverage gap, making too much to qualify for Medicaid assistance, but not enough to buy private insurance. Sandra is an insulin-dependent diabetic who needs 3 shots of insulin a day, along with medication for high blood pressure, but she has no insurance.
I couldn't pay for all these meds. There was just no way. And my husband on disability, just doesn't make enough on it to pay for my meds too.
She knows she's not the only one.
There are so many people that either are unable to work or they don't have a job that they can actually support themselves with. And the cost of medications are just unbelievable.
Dr. Nicholas Twidell is a cardiologist who volunteers at the clinic 2 evenings a month. Twidell says even some patients with insurance use the free clinic as their medical home.
Even with subsidies, their out-of-pocket costs and deductibles are still very high, and so it ends up that perhaps they make a choice that, well, these premium support, I'm still paying for that, and I've got a high deductible, why don't I just stay with what I got?
The clinic, offered by the Western Oklahoma Family Care Center, is one of the few free clinics available in Western Oklahoma. The center also manages one of only 2 free dental clinics west of Oklahoma City, providing dental care for adults. During the past year, the medical clinic has seen more than 500 patients, whose total visits number more than 1,600. It's the same story at the dental clinic, where 470 patients made a total of 1,238 visits, and the numbers are rising.
In the dental clinic especially, we've got a 12 to 18 month waiting list. It used to be 6 to 12 months, now it's 12 to 18 months. 200 some odd people are trying to get into the clinic for the first time.
Tim Ball is the center's current executive director. Ball says while the ACA was designed to help people get health insurance, many of the patients who come here don't qualify, either because they have no evidence of income or their income is too low.
What would happen at that point is that they would be referred to the state's Medicaid program. Oklahoma elected not to go that direction, so we bypass that and go straight to a recommendation, which we heard from one of the agents last week, is you need to refer them to your local free clinic.
The clinic helps fill the gap in medical care, but its resources are limited.
We're maxed out in terms of our capability to provide services without a significant infrastructure increase. And that's difficult to get funding for infrastructure. Everybody wants to contribute to helping people, but not to building the organizations that can help people.
The center came very close to shutting its doors last summer.
One of my jobs as the accountant for the organization is to figure out a point at which we have to start cutting back to try and prolong the operation. And from probably May until September of last year, the projection was we were within 2 months of shutting down.
The situation isn't quite so dire now, but Ball plans to step down in the near future as executive director to bring in someone who can put the center's fundraising efforts on more solid ground. Dr. Boyd Shook can sympathize with the struggles in Elk City. Shook has been running a free clinic in the basement of the Epworth United Methodist Church in Oklahoma City for almost 20 years.
We treat 5,000 to 6,000 people every year. We see 150 to 200 people here every Saturday.
Volunteer doctors and medical students under Shook's supervision examine patients, prescribe medications out of the clinic's pharmacy, and do a limited number of laboratory tests. Just as in rural Oklahoma, most of the patients that come here don't make enough money to qualify for subsidies to buy health insurance.
Many of our folks would be eligible for Medicaid, but because there is no coverage under that, they are not eligible for Medicaid. If Oklahoma elected to pull Medicaid under the Affordable Care Act, we think that we would have a significant decrease in our patient needs.
Grants cover about 15% of the clinic's cost, with donations making up the rest. That makes keeping the doors open a challenge.
We never know where our next month is coming from. As a matter of fact, the Vietnamese community, through the Catholic Charities, gave us a grant just last month, and we weren't certain where the rent money was coming from at that time.
Despite the challenges, the clinic continues to operate each Saturday from 9 to noon, closing only for Christmas and the 4th of July. Since opening its doors in 1995, the clinic has provided medical care to more than 15,000 patients.